Hi, this is Mandy Chamberlain, the occupational therapist with Seniors Flourish. I'm just going to show you a quick little technique that you can use with your patients that have Parkinson's that perform retropulsion during functional transfers. So what that means is basically instead of the patient shifting forward with their weight in order to perform a safe functional transfer, they are pushing backwards. They call them pushers. So some of the equipment that I use for this is I have red tubing, red Thera tubing, but you can use any kind of string or rope or anything you have in the clinic. And then something to weigh down each of the ends. And I have some fancy hand sanitizer and a chip clip. So basically anything you can come up with, you can use for this activity. Okay, some of you have maybe seen the technique where you have a pillow or a ball, like a therapy ball or a balloon, and then you have the patient, let me back up just so everyone can see, get them set up in the position you want and have them lean forward so they touch the pillow to the floor, so they shift their weight forward in order to stand up properly. Well, I don't know about you, but most of my older adults that I work with, they need something to hold on to. It's just not safe to do that transfer. And most of the time when I'm teaching them these techniques, or they're going to be getting off a bed, they're going to be getting off a commode. So naturally I'm wanting them to hold on to a stabilizing armrest or something. So that's probably not the most functional. So that's why I kind of thought of this technique. So I'm going to get this out of the way, and what I use is my band, like I was saying, and I have them put it around their neck. Of course, I'm only going to have them do that with me while we're doing training. So have them get in their position, and I'm going to be using this as a visual cue, or even maybe a little bit of a tactile cue, because they could probably feel it through the TheraBand onto the floor. But basically, I'm going to have them scoot to the edge of the chair like it would normally anyway, get their legs in good position, and let this hang so that when they are leaning forward, they can still hold on, and they can look down and or feel through the pull on the band that the weight is touching the floor. So that means they've shifted their weight enough that they can stand up. So that is just one of my techniques that I've been using for some of my patients that have Parkinson's, and it's been working really well. I think it's a really practical technique instead of something that they can actually feel, because they can't necessarily feel it in their own body while they're doing that functional transfer. So if you have something that they can see and that they can feel while they're doing the transfer, that helps for safer transitional movement and weight shift forward, so that they're not standing backwards, but they're transferring their weight forward. So hope you liked this video. If you liked it, or if you thought it was really helpful and you want to share it with other therapists, that would be great. I'd really appreciate it. And if there's any other techniques or any other tips that you think you would like to learn more about, I'm going to be doing some randomly. And so I'm always open to suggestions. And you can always find me on seniorsflourish.com. Thank you.